My name is Irina, and for the educational purposes for NR509NP class, Advanced Physical Examination, I'm going to perform this physical exam on my patient who's going to give me permission.
My name is Jennifer, and I give Irina consent to perform and record and submit this video for educational purposes to Chamberlain's College of Nursing.
I'm going to screen our surrounding area at 360 degrees. I'm going to begin with introducing myself. My name is Irina. I'm going to perform this physical exam. I'm going to start with inspecting Jennifer's head and her face. Her head is normal cephalic. It's atraumatic. It is midline. Her face is without any lesions, abnormalities. It is symmetrical. Her skin is of normal color. It's pink. Next, I'm going to palpate lymph nodes. I'm going to start with preauricular in front of the ear, postauricular behind the ear. I'm going to move down to occipital at the base of the head and move down to tonsillar and underneath the jaw, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, and I was palpating for any nodules, any abnormalities, any swelling. And did you feel any pain as I was palpating? And I did not palpate any abnormalities. Next, I'm going to assess cranial nerve number 5, which is trigeminal nerve. It has two functions, motor and sensory. And to assess motor function, I'm going to have you clench your jaw for me as I'm palpating over the masseter muscle right in front of her bilateral ears. And I did not palpate any abnormalities, any distortions or deviations or subluxations. Did you feel any pain as I was palpating that? And the sensory portion of the cranial nerve number 5, I'm going to ask Jennifer to close her eyes as I'm using my finger and touching her face. Let me know where I'm touching you.
Forehead, right cheek, left cheek, chin, nose.
And sensory portion of cranial nerve number 5 is intact. Next, I'm going to assess cranial nerve number 7, which is facial nerve, and I'm going to do so by asking Jennifer to make several facial expressions. Please smile for me and frown, and raise your eyebrows, and puffer your cheeks, and pucker your lips for me. And cranial nerve number 7 is intact. Next, I'm going to assess cranial nerve number 2, which has 3 functions. It has central vision, it has peripheral vision, and it has pupillary constriction function. And I'm going to start with using our Snellen 20 feet Snellen chart and have Jennifer stand at 20 feet and cover your left eye, please. And go ahead, read the lowest line that you can see.
D-E-F-P-O-T-E-C.
Okay, now cover your right eye.
D-E-F-P-O-T-E-C.
And now with both eyes.
D-E-F-P-O-T-E-C.
And Jennifer's cranial nerve 2, the central vision is intact, and it's at 20/20 in her left eye, in her right eye, and in both eyes. Next, I'm going to assess her peripheral vision, which is the second function of the cranial nerve number 2. Go ahead and stand for me. And let me know if you see my hands.
No.
Can you see my hands? Let me know when.
No.
Can you see my hands?
No.
Let me know when. Okay. Can you see my hands? Let me know when.
No.
Very good. And the peripheral vision is intact. Next, I'm going to shine in her eyes and assess her pupillary responses. Please focus your... Can you focus your gaze at my nose, please, as I'm shining this light in each eye? And Jennifer's pupils are equal, round, reactive, and they're at 3 millimeters bilaterally. And her cranial nerve number 2 is intact. Next, I'm going to assess cranial nerve number 3, 4, and 6, and which is oculomotor, trochlear, and abducens. And we're going to use a shape H, and Jennifer is going to follow my finger to assess both of her eyes. And all her EOMs are intact. Next, I'm going to assess her ears, and I'm going to do so by looking at each ear, and they're symmetrical, and I don't notice any lesions or any abnormalities. And I'm going to palpate bilateral peni and her tragus. Let me know if you feel any pain. No. I'm going to use my light and assess inner ear. I'm going to pull her peni back and up, and I'm assessing for any cerumen, any swelling, drainage, any bleeding, any redness. I'm looking at her tympanic membrane, which is intact. It's purely gray. It does not have any bulging. It does not have effusions. I don't see any abnormalities in her ear. Next, I'm going to pull her peni up and back on her left ear, and I'm going to look at her tympanic membrane, which is very good visualized as well, and it's purely gray. I don't see any abnormalities. I don't see any drainage, cerumen, any bleeding, redness. There's no effusion. There's no bulging of the eardrum. Next, I'm going to assess cranial nerve number 8, which is vestibulocochlear, and it's using whisper test. We're assessing her hearing, and I'm going to have you cover your left ear and whisper 3 words.
1, 2, 3.
Okay, now cover your right ear. I'm going to whisper 3 words.
ABC.
And her cranial nerve number 8 is intact. Next, I'm going to assess her sinuses, and as well, I'm going to assess her conjunctiva in her eyes as we're continue to assess her face. And I'm going to pull her eyelids down, and I'm assessing her conjunctiva and her sclera, and I don't see any redness or draining. Her conjunctiva is pink and moist. There is no abnormalities or lesions. Her sclera is clear and white. And I'm going to assess her sinuses as well. I'm going to palpate your frontal sinuses. Do you feel any pain as I'm palpating that?
No.
And her maxillary sinuses. Do you feel any pain as I'm palpating? No. Okay, very well. Next, we're going to assess Jennifer's nose. And I do not see any abnormalities. Her nose is midline. It's atraumatic. I'm going to shine my light and assess her inner nares by pulling her nose upwards. And her septum is midline. Her lateral turbinates are pink and moist. There's no bugginess, no drainage, no abnormalities. Her left nare, lateral turbinates are pink and moist. Her septum is midline. I don't see any bugginess or abnormalities, no polyps or drainage or bleeding that I can see. We're now going to assess olfactory cranial nerve number 5 for the purposes of this examination, but we are going to go further and assess her mouth. And I'm looking at her lips, if there's any chapped lips or any lesions on her lips, and I don't see that. And I'm going to shine my light and assess Jennifer's mouth. And I am looking at her teeth. There is no cracks. All her teeth are intact. I don't see any decay. Her gums are pink, moist, and I don't see any bleeding, swelling, or redness. Bilateral buccal membrane is pink and moist. I don't see any abnormalities. Her hard palate is intact. Go ahead and stick your tongue out and say ah. Her bilateral soft palates are pink and moist. I don't see any lesions. Her tongue is smooth. I don't see any lesions on the tongue. It's pink and moist. Go ahead and lift your tongue up. I don't see I'm assessing the floor of the mouth, and I don't see any abnormalities. I don't see any lesions. It is pink and moist. Go ahead and stick your tongue out and say ah again.
Ah.
And as she's saying ah, I'm assessing cranial nerve number 10, which is vagus cranial nerve. And at the same time, as she said ah, her uvula and bilateral soft palates rise very nicely. So cranial nerve number 10 is intact. Next, go ahead and open your mouth. And I'm assessing her posterior, stick your tongue out and say ah, posterior pharynx. And I don't see any lesions, any abnormalities. Her tonsils are surgically removed, otherwise I would grade them. I don't see any postnasal drainage, and I don't see any oposities in the posterior pharynx. For the purposes of this examination, we are now gonna check for gag reflex, which is glossopharyngeal cranial nerve number 9. We're going to assess cranial nerve number 12, which is hypoglossal, and I'm going to do that by asking Jennifer to stick your tongue out and move it left and right. And it's symmetrical and intact. Next, we're going to move down and look at her neck, which is midline. It's symmetrical and it's of normal size. Her trachea is midline, and I don't see any deviation. I am going to palpate her thyroid, and I'm going to find two landmarks, supraclavicular, suprasternal notch, and her cricoid cartilage are the two landmarks, and thyroid is located in between those two landmarks. I'm going to retract back on the right side and have Jennifer swallow. Okay, and I'm going to do the same as I'm palpating for size, shape, and abnormalities of the thyroid. I'm going to retract on the left side and have Jennifer swallow. And as she swallows, I did not feel any abnormalities, and her thyroid rise up and down very nicely. I did not notice any nodules or any swelling, goiter, or any thyroid abnormal sizes or shape. Next, I'm going to use the bell of my stethoscope and auscultate her bilateral carotid arteries. And as I do so, I'm going to ask Jennifer to take a deep breath and hold. Go ahead and take a deep breath and hold. Exhale and inhale. I was auscultating for any bruits or any abnormalities, which I did not hear. Excuse me. Bless you. I'm going to palpate her carotid arteries one at a time, bilaterally. And her carotid arteries bilaterally are present and bounding and very strong, and they're equal bilaterally. Next, I'm going to assess cranial nerve number 11, which is spine-accessory cranial nerve, and we're going to do so by asking Jennifer to shrug her shoulders against resistance. Go ahead and shrug your shoulders. Very good, and they're strong bilaterally, equally, and within normal limits. Next, I'm going to assess Jennifer's range of motion of her neck, and I'm going to ask you to touch the chin to your chest, please, and which is flexion. Go ahead and look at the ceiling for me as far as you can, and that is extension, and she performed that very well. Let me know if you feel any pain as I'm doing so. So now I'm going to have you touch your right ear to your shoulder, and that is right lateral flexion. And now go ahead and touch your left ear to your left shoulder, and that is left lateral flexion. And now look to your right for me, and now look to your left for me, and that is external rotation. She performed that very well. They're both intact. Next, I'm going to auscultate Jennifer's heart tones, and I'm going to use the bell of my stethoscope and a diaphragm. I'm going to find landmarks of aortic, pulmonic, Erb's point, tricuspid, and mitral valves. I'm going to start with the diaphragm, and we're going to auscultate aortic valve at the second intercostal space, right sternal border, and then pulmonic valve at the second intercostal space, left sternal border, Erb's point at the third intercostal space, left sternal point, and then tricuspid valve at the fourth intercostal space, left sternal border, and then mitral valve at the fifth intercostal space, left midclavicular line. And I did not hear any abnormal sounds. S1, S2 is strong and present. I did not hear any clicks or murmurs or any abnormal sounds. And now we're going to do the same thing with the bell. We're going to auscultate over aortic valve at the right second intercostal space, right sternal border, pulmonic valve at the second intercostal space, left sternal border, Erb's point at the third intercostal space, left sternal border, tricuspid valve at the fourth intercostal space, left sternal border, and then mitral valve at the fifth intercostal space, left midclavicular line. And again, I did not hear any abnormal sounds. S1 and S2 are present and strong. I did not hear S3 or S4 sounds. Next, I'm going to auscultate her breath sounds anteriorly and posteriorly. And I'm going to do so by using the diaphragm on my stethoscope and finding intercostal spaces. And I'm going to ask you to take a deep breath in and out as I do so. And her anterior breath sounds are clear bilaterally. Go ahead and stand for me, please, and turn to face the wall. And I'm going to listen over the 8 landmarks posteriorly. I'm going to start above her scapula. Go ahead and take a deep breath for me. And I'm going to auscultate laterally her right middle lobe. As on the right side, we have 3 lobes, and on the left side, we have 2 lobes, and her bilateral breath sounds posteriorly are clear bilaterally. Next, I'm going to perform exam of the extremities. So go ahead and raise your hands up for me. And I don't see any abnormalities, any swelling, any deformities of her joints. I do not see any abnormal discoloration of her skin. I'm going to ask you to squeeze my hands, please. And bilateral hands are strength 5 out of 5, equal bilaterally. I'm going to check for cap refill by pressing her finger until it turns white, and when I release it, it turns back to pink within 3 seconds. And I'm going to do that bilaterally, and her cap refill is within normal limits. It's less than 3 seconds. Next, I'm going to palpate her radial pulses, and her radial pulses bilaterally are equal and present. and about 3+ bilaterally. Next, I'm going to assess strength of her biceps and triceps. I'm going to bend your hands for me and push against resistance and then pull against resistance. And her bicep and tricep bilaterally equal and present 5 out of 5. Next, I'm going to assess cerebellar coordination by having you touch your thumb with index finger, middle finger, fourth finger, and fifth finger, and then go ahead and continue by increasing speed. Okay, very well. Okay, now I'm going to have you put your palms of your hands on your thighs, and I'm going to have you supinate and pronate and increase the speed. Very well. And her cerebellar coordination is intact. Next, I'm going to assess range of motion of her elbow and her shoulder, and then deep tendon reflexes. And we're going to do that unilaterally for the purposes of this exam. Normally, we would do that bilaterally. I'm going to have you flex your elbow for me. That is flexion and extension, and she did that very well. I'm going to flex your shoulder, and now extension, internal rotation, external rotation, abduction and adduction across medially, and she did that very well. Next, we're going to perform deep tendon reflexes, and we're going to start with the bicep. And I'm going to have Jennifer rest her hand on my arm, and I'm going to palpate medial aspect of the antecubital fossa and use the pointy edge of my hammer. I'm going to strike my thumb, and she had a very nice response. Next, we're going to check patellar deep tendon reflex, and I'm going to use the flat portion of my hammer and strike her patella. Go ahead and relax your foot. And she had a very nice response there. And now I'm going to gently dorsiflex her foot and rest on my hand. I'm going to use the flat portion of my hammer. I'm going to check for Achilles tendon, deep tendon reflex. And she had a very nice pronation as I stroke her Achilles tendon. Next, we're going to examine Jennifer's abdomen. We're going to move the camera and have Jennifer lie down and expose her abdomen. To perform abdominal examination, we're going to inspect first, and I'm going to inspect for any kind of abnormal landmarks, for contours, for any scars or any kind of abnormalities that we can visualize, any kind of bulging or asymmetry, and I don't see that. On her abdomen is flat and symmetrical. Next, I'm going to use the diaphragm, my stethoscope, and I'm going to auscultate each quadrant in her abdomen for at least 15 seconds. I'm going to start with the right upper quadrant, then I'm going to move to the right lower quadrant, then left lower quadrant, and left upper quadrant. And we're listening for bowel sounds, and all her bowel sounds are present and active in each quadrant. Next, I'm going to use a diaphragm of my stethoscope. I'm going to auscultate arteries, starting with aorta, which is inferior of her xiphoid process and superior of her umbilicus. I'm going to auscultate for at least 5 to 10 seconds for any bruits or any abnormalities. Then I'm going to move to the left renal artery, which is located on left lateral and left lateral area superiorly of her umbilicus, that is left renal artery. Now I'm going to move to the right renal artery, right laterally, superior of umbilicus. Next I'm going to move to right iliac artery, which is located right laterally, inferiorly of umbilicus. Next, I'm going to move to left iliac artery, which is located left laterally and inferiorly of her umbilicus, and I don't hear any bruits or any abnormalities. Next, we're going to percuss, and I'm going to struck my middle finger for any dullness, tympany, or flatness. I'm going to struck my middle finger. And percussion test is negative, but it is normal. Next, I'm going to palpate her abdomen for any masses or any abnormalities and or any tenderness. Please let me know if you're feeling any pain. I'm going to go deeper in the right lower quadrant, then right upper quadrant, kind of go in circles, then left upper quadrant, and then left lower quadrant, and I did not feel any masses or any abnormalities. Do you feel any pain?
No.
Next, I'm going to do a Bloomberg test, which is I'm going to use my hand at a 90-degree position, and I'm going to press down her abdomen, and this is a test for rebound tenderness. And please let me know as I release my hand if you feel any pain or tenderness.
No pain.
Okay, do the same. Let me know if you feel any pain or tenderness.
No.
Next, I'm going to palpate her liver and spleen. I'm going to support with my left hand posteriorly her costovertebral area. As she takes a deep breath, I'm going to palpate inward, downward, and upward to palpate for her liver. Go ahead and take a deep breath. And I could palpate the lower portion of her liver, but I do not at this point. Now go ahead and rotate my way. I'm going to palpate her spleen, and I'm going to use my right hand and support posteriorly her costovertebral area, and then use my left hand, and I'm going to the same thing, have her take a deep breath as I am palpating inwards, downwards, and upwards. And I did not feel her spleen, which is a normal test. Next, I'm going to assess her lower extremities. And again, we're going to do so unilaterally for the purpose of this examination. And I'm going to start with assessing her skin for any edema, any varicosity, any abnormal discoloration, and any abnormal temperature of her skin. I'm also going to palpate her bilateral pedal pulses, which are present and tuned plus and strong and equal bilaterally. Next, I'm going to assess strength of bilateral ankles, and I'm going to have you point your feet upwards against resistance, which is a dorsiflexion against resistance, and then go ahead and push against my bilateral hands, and that is plantar flexion against resistance, and they're bilaterally equal and strong. I'm going to have you bend your knees for me and go ahead and push against my hands, okay? And then pull against my hands, very good. And that was checking bilateral strength of her knees and as her ankles and her knees strength both equal bilaterally, 5 out of 5. Next, I'm going to assess her ankle flexion, extension, and rotation. So go ahead and that is dorsiflexion, okay, and plantar flexion and rotation, and that is present. Next, I'm going to assess her knee flexion and extension. And she did that very well. And we're going to assess her hip flexion. And for the purposes of this examination, we will not assess her hip extension. We're going to start with flexing her knee. Then we're going to flex her hip, which she did that very well. And next we're going to do internal rotation, external rotation, abduction, and adduction over medially. And she did that very well. Next, I'm going to assess Jennifer's spine. Jennifer, I'm going to have you stand again. I'm going to move my camera. Well visualize. I'm going to start with palpating her spine for any deformities, tenderness, abnormalities, rotations, bulging. Please let me know if you feel any pain as I'm palpating.
No.
And I did not palpate any abnormalities. Next, I'm going to have you touch your toes with your hands, and that is flexion of her spine. We're going to assess how range of motion of her spine. Now I'm going to ask you, look at the ceiling as far as you can, and that is extension of her spine. Now go ahead and lean to your left, and that is left lateral flexion, and now to your right, and that is right lateral flexion. Now go ahead and rotate your spine back and forth several times. And she performed that very well. And did you feel any pain?
No.
Next, we're going to check for Romberg's sign, which is I'm going to have you turn my way and close your eyes. And we're going to observe her gait for about 20 seconds for any swaying or any abnormalities. And I don't see that. Her Romberg sign is negative. Next, I'm going to have you walk towards me a few steps. And then we're observing for gait, and now walk away from me. And her gait is steady. I did not see any swaying or any abnormal gait. And that concludes my examination for NR509NP for Chamberlain University. Thank you.